My testimony has four sections. Section 1 is WOPEC and its investigations into organ harvesting. World Organization to Invest the Persecution of Falun Gong was established on January 20th, 2003. Up to May 2016, we have published 331 investigative reports and have compiled a list of more than 76,000 individual perpetrators. We have systematically investigated on the crimes on the forced organ harvesting over the last 10 years, and we have published 43 reports. In June 2015, we published a comprehensive report over here in which we laid out 1,628 pieces of evidence proving that more than 865 hospitals and more than 9,500 surgeons in China who have been involved in this huge number of transplant operations. We have conducted more than 10,000 telephone interviews with Chinese government officials and surgeons, procured 60 recording testimonies from high-ranking government officials, including 5 CCP Politburo Standing Committee members. These testimonies reveal that the majority of the extracted organs were from living Falun Gong practitioners, and the order came from the CCP's highest level. Since then, we have published another 9 additional reports confirming that the organ harvesting on Falun Gong practitioners is still happening, and in some places might be accelerating. We have another report over here. We would like to submit these 2 reports to the Congress for the record. So far, we have, actually my focus today will be the academic papers published by the doctors inside China, mostly from year 2000 to 12. So far, we have collected more than 3,000 academic papers. Out of 300 of them had descriptions on donors. We have found evidences proving that the existence of the large organ living donor pool, strengthening the previous conclusion of harvesting organs from living persons by the CCP. They are the written testimonies in public domain provided by those doctors who have been involved in this heinous crime. Section 2, medical papers and publications indicate that a huge liver donor pool exists. Number 1, very short waiting time. Number 2, in April 2006, one hospital in Hunan offered 20 livers and kidneys for free to allure more business. They had access to a very large donor pool. Number 3, the abundance of the donors have even made Chinese medicine hospitals, forensic hospitals, psychiatric hospitals to conduct organ transplant operations. Number 4, a large number of emergency transplant operations. China Liver Transplant Registration Project was started in early 2005. More than 8,000 cases had been collected up to December of 2006. Among 4,300 cases with available data for timely manner, 1,150 cases were of emergency operations, which was as high as 27%. The shortest time to start the operation was 4 hours after the patient was admitted. The same database provides that only 2% of the donors were living donors. All the others were dead. By contrast, only 6.5% of liver transplant performed at a leading transplant center in Canada from 1994 to 2008 was for acute liver failure, which needs emergency transplant in 48 to 72 hours. Canada has a matching system supposed to be much more efficient than anything illegitimate for matching up in China. A more plausible explanation is that it is the donors wait for the recipients in China. Number 5, abundance of donors provide multiple standby donors for transplantation surgeons. One typical case was Huang Jiefu. Huang Jiefu's liver transplant operation in Xinjiang on September 28, 2005. The first donor's liver was discarded after Huang opened the abdominal cavity of a cancer patient and it discovered that it happened to meet the criteria for an autologous liver transplant. He then closed it and contacted Guangzhou City and Chongqing City, requesting spare liver. In case the autologous transplant failed, matching livers were found in both cities in several hours and arrived in Xinjiang almost at the same time at 6:30 p.m. on September 29th. Another spare liver was found in Xinjiang. The operation lasted from 7 p.m. on September 29th to 10 a.m. next day. After 24 hours of observation, Huang announced the spare livers were no longer needed. The acceptable cold ischemia time for liver was less than 15 hours even in China. Therefore, one can safely say that the 2 spare livers brought from Chongqing and Guangzhou City could only be 2 intact living persons. Otherwise, the extraction, the flight, the operation, and the observing timing would be at least 50 hours. The spare livers would have no value. Section 3. Medical papers indicate a large-scale care-on-demand organs transplant system. Number 1, abnormal descriptions on the donors. 103 papers have information about the donors. The total number mentioned was 8,710. 80 papers had the ages from 20 to 40 years old, with average in the 20s. While in the US, average age of deceased donors in 2006 was a little over 40. The vast majority of the descriptions regarding the health condition of the donors are perfectly healthy. There is no history of contagious disease, cardiovascular disease, cancer, or drug abuse, etc. One might wonder why these young and perfectly healthy people would donate their organs and die. Number 2, brain death in China. A simplified definition of brain death is the death of all central neurological tissue resulting in the loss of cerebral functions. Strict procedures and long-time observing should be implemented before announcing the brain death. In the US, there were about 6,700 living donors and 8,000 deceased donors in 2006. The 3 major causes of death were cerebrovascular stroke, head trauma, and anoxia brain death. B. In China, there is no legal definition or procedure to follow to announce a person brain dead. One article on Tenxin.net in 2014 cited Huang Jiefu, stating that 90% of the doctors in China don't know the criteria for brain death. It was still not a good time for China to enact a brain death law. 137 papers described the causes of the death in over 5,000 donors. 59% were brain death. Further analysis revealed that the vast majority of these brain deaths were actually living people. C. China's leading expert on brain death, Chen Zonghua from Tongji Medical College, has been exploring using the internationally accepted brain death criteria in organ transplantations. An article by his group on Journal of Organ Transplant in July 2010 stating that 60 cases of organ extractions were conducted from brain death donors in China since 2001. That's 10 years period of time. In July 2006, they conducted the first ever heart transplantation using a brain death donor in the country. Chen Zhonghua's numbers clearly indicated that the vast majority of these cases of extractions are not from truly brain death donors. Because it is not a legal practice at all in China to announce a patient brain dead, and there is no formal training or certifications for the doctors, they should be still alive when their organs were taken. D. We found 5 papers with 22 cases describing the procedure of endotracheal intubation after the brain death. This makes no medical sense. The diagnosis of brain death needs hours of observation and testings. Endotracheal intubation should be done in the process or before that in order to save the life of the patient. These doctors have confirmed that they did not understand the criteria for brain death, nor did they care if the donors were brain dead. The donors were actually living people. E. The other 3 major causes of death in the papers, cadaver, sudden death, and non-heart beating, did not give any information on how these donors died either. Number 3, extremely short warm ischemia time. Warm ischemia time here refers to the amount of time that an organ remains warm after its blood supply has been stopped or reduced. 89 papers had close to 7,000 cases on the warm ischemia time from donors with brain death, cadaver, or sudden death. Most of them is under 10 minutes. Some mentioned the cause of the death. 688 cases were brain death. One had 117 cases of fresh cadavers with heartbeat just stopped. With brain death not practicable and almost no explainable legitimate cause of death, then why almost all organ procurements have such short warm ischemia time? The most plausible explanation is that these donors have been arranged to die when the organ procurements need to happen. This is mass murder. Section 4. In 6 papers, 42 doctors admit they have killed at least 677 living people for their organs. Number 1, journal transplant May 2011, Yang Shouguo, etc., from a transplantation center in Shanghai, described 298 cases of heart transplantations in 11 years from May 2000. On donor descriptions, it reads, 291 hearts were from cadavers. 7 hearts were from brain-dead donors, 18 to 45 years old, average 27. All donors had no obvious history of cardiovascular disease or other major organ diseases. Among these 298 cases, after year 2007, 60 hearts were extracted when the donors had ventricular fibrillation or after the hearts stopped beating, and the rest were extracted while the hearts were still beating. The authors admit here that at least 231 healthy young people, while not brain dead and their hearts still beating, were killed for their hearts. Number 2, Chinese General Practice, December 2007, Li Yaofeng, etc., talked about 103 liver transplantation between 2004 and 2007. It reads, the donors for both groups of recipients were healthy young people. One of them was brain dead. All others were same blood type, cadaveric livers. All warm ischemia times were between 0 and 5 minutes. The conclusion should be easy to draw. At least 102 young people have been killed for their organs. Their accounts show that the practice of forced organ harvesting is real and done on a very large scale. I'm going to submit these 6 papers to the Congress for the record.